What if one of the biggest medical decisions you'll ever make is also one of the least questioned? Every year, millions of adults over 65 are told they need surgery, a new heart procedure, a spinal fusion, a joint replacement. And most people assume the same thing. Doctors recommended it, so it must be the best option. But what many older adults don't realize is this. After 65, surgery follows an entirely different set of rules. The risks change, the recovery changes, and sometimes the surgery itself can be more dangerous than the condition it's meant to treat. Today we're going to look at 5 surgeries doctors quietly say require extreme caution after 65, and the 5 questions every older adult should ask before agreeing to any procedure. One of these questions alone could save you from months of unnecessary suffering. Let's start with something most people are never told. Surgery isn't just about the procedure. It's about how the body handles the stress of the procedure. After 65, several things change. The body metabolizes anesthesia more slowly. Recovery from trauma takes longer. Muscle loss accelerates during bed rest. And existing health conditions complicate healing. Doctors call this physiological reserve. When you're younger, your body has extra capacity to recover. After 65, that reserve is often smaller, which means complications that a 40-year-old might bounce back from can trigger months of decline for someone in their 70s or 80s. That doesn't mean surgery is always bad. Many procedures save lives, but some operations are far more complicated for older adults than people realize. Let's look at the first one. Coronary artery bypass surgery, often called CABG, is one of the most common heart surgeries performed. For younger patients, it can dramatically improve blood flow and extend life. But after 75, the equation changes. The procedure itself is extremely demanding. It involves opening the chest, stopping the heart temporarily, using a heart-lung machine, and a recovery that can last months. For older adults with other medical conditions, complication rates rise sharply. Some studies show higher stroke risk, higher infection rates, and significantly longer hospital stays. For certain patients, less invasive options like stents or medication can offer similar benefits with far less risk. The key point is this: not every blocked artery needs open heart surgery, especially later in life. Which brings us to surgery number 2. Hip and knee replacements are incredibly common, and for many healthy seniors, they can be life-changing. But there's something surgeons often evaluate called frailty. Frailty isn't just age, it's a combination of factors: muscle weakness, slow walking speed, weight loss, poor balance, multiple medical conditions. For frail patients, joint replacement can become a different experience entirely. The surgery is only step 1. The real challenge is rehabilitation. Physical therapy after joint replacement is aggressive and demanding. Patients who cannot complete that rehab often end up with limited mobility, chronic pain, or dependence on walking aids. For some individuals, non-surgical options may work surprisingly well. Targeted physical therapy, weight reduction, anti-inflammatory treatments, injections. Sometimes improving strength around the joint can delay surgery for years. Back pain is one of the most common problems after 60, and spinal fusion surgery is often offered as a solution. The procedure permanently joins vertebrae together using rods, screws, or bone grafts. But here's the concern. For adults over 70, success rates can be shockingly low. Some studies suggest less than half of patients experience meaningful pain relief. In fact, many report the same or worse pain afterward. Why? Because back pain often comes from multiple sources, not just one unstable joint. Before considering fusion, many specialists recommend trying core strengthening programs, specialized physical therapy, acupuncture, massage therapy. For many people, strengthening the muscles that support the spine can dramatically reduce pain without surgery. Emergency abdominal surgeries are some of the most difficult decisions families face. These procedures are often performed for bowel obstruction, ruptured organs, severe infections. For very elderly patients, especially those with advanced dementia or multiple chronic illnesses. Outcomes can be challenging. In some cases, the surgery may extend life, but not necessarily improve quality of life. Recovery may involve prolonged ICU stays, feeding tubes, long-term institutional care. This is why doctors strongly encourage families to discuss advanced directives before emergencies happen. Knowing someone's wishes ahead of time can prevent incredibly difficult decisions later. Cancer treatment decisions change dramatically with age. Many cancers grow very slowly in older adults, and aggressive surgery can sometimes cause more harm than benefit. For certain patients, doctors recommend something called active surveillance. Instead of immediate surgery, the cancer is monitored closely with scans and tests. Why? Because some patients are far more likely to die with the cancer rather than from it. That approach allows people to maintain quality of life without undergoing extremely invasive procedures. Before agreeing to any procedure, experts recommend asking 5 simple questions. These questions can completely change the conversation. 1. What happens if I don't have this surgery? Sometimes the answer is surprisingly reassuring. 2. What is my personal risk of complications? Not the average patient, you specifically. 3. How many of these surgeries have you performed on patients my age recently? Experience with older patients matters enormously. 4. What non-surgical options exist? And why won't they work? Sometimes alternatives haven't been fully explored. 5. What will my life realistically look like in 1 year after this surgery? Pain levels, mobility, independence. That answer matters more than almost anything else. The goal of medicine isn't simply to add years to life. It's to protect the quality of those years. Surgery can absolutely save lives, but the best decision is always an informed decision. Get second opinions, ask questions, and remember, the right treatment is the one that helps you live well, not just live longer. If you're over 60, I'd like to ask you something important. Have you, or someone close to you, ever faced a difficult decision about surgery? What helped you decide? Share your experience in the comments. Your story might help someone else. And if you care about staying strong, independent, and informed after 50, subscribe to the channel. Because the truth is, aging well isn't about luck. It's about knowing what most people were never told. And we'll keep uncovering those truths.